Well, I think that's an interesting question because I used to have a highly uh, manufactured answer to it that I thought was the truth because my father was very interested in, I suppose, whole foods and healing in that way. And he actually did heal his own heart condition through dietary changes. And I suppose that had a big influence on my life, but that was also really much earlier on. And I think ultimately, and it sounds a little bit strange, but I think being a practitioner was a bit of a calling for me. And I really enjoy being with people, but I also enjoy solving problems. So sometimes, when people come to see me, it's a human problem, like a physiological problem that I get to solve. So, that's what I've discovered along the way is what really speaks to me and fulfills me. Treating skin conditions and that includes things like acne and eczema and hives and molluscum and all sorts of things, pityriasis, rosacea, tinea, all sorts of skin conditions. And I suppose what that brings with it, because a lot of it has hormonal changes, particularly acne, so I do treat a lot of things to do with women's health, particularly reproductive health. And then also the other aspect of treating skin conditions is that things like eczema tend to show up quite early in life. So I treat a lot of children as well. So I treat them for skin conditions, but also other things that arise like recurrent infections, chronic constipation, other, sore tummies, and some behavioural issues as well. So they're the areas that I really like to, and the spaces that I really like to work in. I do have a special interest in it because I dealt with a skin condition when I was young. So not really young, I had acne that came sort of at the end of high school or sort of after high school. That's when it really started to appear, not in the typical time of life. And it was really, like, I can't really understate how upsetting it was for me, to be in my first year at uni and dealing with pimples all over my face, dealing with the first time of life where you're sort of socializing outside of school. And it really, really impacted my confidence in probably every part of life, in my work, at university, with dating, with friends. It really impacted my self-confidence. And I think I have a really special place in my heart for people who are dealing with the same stuff, because it's not just a disease that they're dealing with. I mean, the thing about stomach pain is that nobody can see it. But you can't hide what's on the outside as much makeup as you like to use. I like taking on cases, particularly with kids, because they're vital and their cells are multiplying at the most ridiculous rate. So they actually have a really high capacity to heal, and I think that's fantastic because you can get to see the work that you're doing and the effect and impact that it's having. And also, I mean, they are just lots of fun to work with in general. And yeah, particularly when it's kids with skin conditions, because they're so uncomfortable, and they don't necessarily have a way of communicating that in language. And I think sometimes it can be underestimated, the impact that maybe that skin condition or that stomach problem or that food intolerance is having on them personally. And I find it interesting when when they are healing and they're getting a lot better, and parents will say to me, wow, it's like I have a different child now, because whatever was going on with them with their health is impacting their mood and their cognition and their behavior. But when it sort of happens over time, sometimes people forget that just because they're small humans doesn't mean that it's not impacting them in the same way that it impacts us. So I find that really rewarding. A patient story that really inspires me is of she's an allied health professional, and she came to see me because she dealt with a lot of patients in a public health setting, and particularly with kids and families. And she had eczema all over her face, and it was essentially more on one side of her face, but it was quite pigmented, quite inflamed, and consistent. And she'd been dealing with this for years. And it was so bad sometimes that she would have to say to patients and parents, hey, it's okay, it's just eczema, I'm not contagious. And I thought, wow, like that must be terrible at work to have to feel like you have to pre-frame your consultation with someone that you're not contagious. And she took on everything that we did. You know, she took it on wholeheartedly, and we tested for foods that, you know, that might aggravate her, and we found the foods that aggravated her. And she was so diligent about removing those foods from her diet. And she did that along with all the other treatments, so the, you know, restoring the gut health and integrity. And then we reintroduced the foods as well. But before we reintroduced the foods, the eczema had completely resolved. No more eczema on her face, no more eczema on her eyelids. And then we reintroduced the foods gradually to see which ones were going to, if at all, possibly reactivate her. And none of them did. And so now she can eat those foods that were identified as intolerant in her testing, and she can eat them intermittently through her week. She can't eat them to the same dosages, as in the daily dosages which she had before, but she has a normal life again, and she can go out and, you know, go to dinner parties and have fun and not have to worry about the impact of what's going to happen. Another patient that I found it really rewarding to treat, and that is a child, and she was about 10 years of age, and her mum brought her to see me primarily because she had these tiny little dots all across her forehead. They weren't pimples and they weren't acne, but they were just lots and lots of tiny little dots. As we dug deeper into that case, I also found out that she was mildly constipated, so she had a lot of abdominal pain, and she also had, strangely, body odor for a young child, which is odd, and she also had really large tonsils, and they were so large that they're obstructing her breathing at night. So she snored really, really loudly. And if you think about it, if someone's breath is obstructed while they're breathing, it also impacts oxygenation. So she'd wake up in the morning like not ready to go to school, not energetic, which for a 10-year-old is odd, you know. And consequently, having some behavioural issues because she hasn't had enough sleep, so she's irritable. So all of this was going on. And so I tested for food intolerances because the presentation sort of seemed to indicate that there were multiple systems and parts of her body being affected at once. And we found out what those foods were, which were mostly gluten and dairy and eggs as well. And her mother was fantastic in being able to adapt the food that they were eating at home. And so those foods were removed. And what's really amazing about this is that she was actually scheduled to have a tonsillectomy, so have her tonsils removed, 3 months prior to coming to see me. So the surgery was scheduled, and by the time we got to the end of that food elimination period, her tonsils were back to normal size. They went to the ear, nose and throat specialist, and he said that she no longer requires surgery, which is incredible. And he couldn't believe it either. He's like, I've never actually seen this happen before. But I have noticed, though, that children with food intolerances having enlarged tonsils or recurrent tonsillitis is a really, really common feature of their case. So one thing I would change about, if I could change about the current health system, is that people are given more time with their doctors and physiotherapists or whoever they're seeing, that they get adequate time to see those people, adequate time to really talk about themselves and their life and work through everything that there is to work through, because people are complex. You know, it's not just that they have iron deficiency anemia. It's like, why do they have iron deficiency anemia? And really starting to dig down and dig into what's going on with this person, that they're constantly dealing with the same thing. And it might not even be something physiological as well. I think, you know, there's a lot of psychological and social pressures now as well that really impact people's health, and I'm not sure that necessarily always gets enough airtime for people to discuss what's going on in their life.
Nice.